Hi, my name is Joy Nix. I'm an assistive technology professional with NuMotion, and today I want to take a couple minutes to go over probably the most common type of power mobility device that people are familiar with, and that is a scooter. Okay, so there are lots of commercials for scooters that we've seen, and so that word is kind of drilled into our brain. One thing I really want to encourage clinicians is to not use that word. Use the word power mobility device in your notes. Just because if a physician kind of documents that a patient needs a scooter, we are really targeted into only getting this scooter. And there's a lot more to the evaluation that does happen once the doctor initiates the order. The therapist and I will actually review not only their functional ability with doing their activities of daily living, but we'll look at their environment, their lifestyle, their goals, where this is going to be used, how much caregiver support they have. So with the term power mobility device, we may go with this, but we might also go with something more like this, like a power wheelchair. And this is a more basic type of power wheelchair. There's of course very complex ones as well, but it's really that evaluation that we do to determine what's most appropriate. So with this scooter, it's really light. It's only about 79 pounds, okay? So it's really helpful for folks when they're getting it in and out of cars or houses. You can see over here that it breaks down into some different pieces. The heaviest piece, I believe, is about 29 pounds. So that's helpful for caregivers. But because it's so light, it is very light. It's not going to support a lot of body weight. It's not as stable. Okay, and that's sometimes why we go with the other options, is for that stability. So for example, if I am someone who needs balance support, if I kind of lean on this, it's gonna fall over, okay, because it's really very tippy because it's so light. When I get in this, my body weight, or the center of gravity, is very high. There's not a heavy base kind of keeping it firmly planted to the ground. Another thing when you get in is you have to have the ability to kind of weave your legs around this tiller like this, right? And there is a way that you can swivel the seat around, but you have to still be able to get your knees around that tiller. So if someone has range of motion issues or pain or edema issues in their legs, that could be difficult. Okay, and when it does drive, it's very narrow, which is really helpful for small doorways, but it also requires a larger turning radius. So to turn, I have to kind of do a wide turn. I can't just turn in place. Another thing about it is you can see it has a very low height for clearance. Okay, so what that means is that you really can only use this on very, very flat surfaces. So it's great for indoors, it's great for concrete or wood floors, it's really good for that. So it's important that we do the home assessment to make sure that this will work in the home. It is great for patients who have full sensation. We're not worried about them getting sores. This type of seat is fine. They can get in and out of it fine. Folks who have maybe a high fall risk, pain issues, things like that, this is really great for them. But if they have more complex conditions, we want to look at other options. Let me know if you want to talk about any patients for this or other devices. Thanks.